So we are here today at the office of Dr. Daniel J. Leeman. We have one of our patients, Mr. Price, who is the newest recipient of a pair of hearing aids right now. If you don't mind, Mr. Price, could you just kind of tell the listeners what really brought you here? What was the process?
I had worked a long time city of Austin employee, retired, and had I realized some hearing damage, and got examined and realized that I needed hearing aids, and ended up coming here after a struggle with lengthy struggle with workers' comp in the city of Austin, and Dr. Leeman's office, Dr. Spinuzza, and also Everett, the administrative support person, were extremely helpful and basically battling for me to help me get the hearing aids that I needed from the city of Austin after the damage had occurred. They were amazing, supportive, and hearing aids work very well.
Good. So you kind of told us what brought you in here. Were you aware of some of your hearing deficits? Some of the patients that we see who have either had loud noise exposure or things like that have issues with tinnitus or ringing in their ears or find trouble picking up on speech with another person in a crowded room. What were some of your symptoms that you noticed?
All of those actually. Mild tinnitus, a lot of trouble hearing my wife would speak to me, have to get her to repeat things, and other people as well. I would misunderstand what they were saying. I would think they would say one thing in a sentence. I'd let them get 2 or 3 sentences down the way and have to realize they actually said something else in the sentence that I had trouble understanding. And hopefully this will cure that issue.
Yeah, absolutely. So how would you kind of describe the overall process when you came here with Dr. Spinuzza and the rest of the team?
They were excellent. They're very helpful, very kind, professional. Dr. Spinuzza was very thorough with the explanation of the hearing aids and how they work. They're actually kind of a bit complicated, very helpful, but you got to pay attention. But the whole staff has been very professional, very polite, very helpful.
Good. We're so glad of that. Another question I guess that we can ask is, what would you like to tell other patients or people who may be suffering from hearing loss or have history of loud noise exposure?
Do get treatment. It'll get worse if you don't get treatment. It assists with the medical staff can explain this, but the issues of other medical complications can occur if you don't get your hearing treated. In addition to just being able to hear well and having, as it's referred to, quality of life. If you're hearing well, it makes a big difference.
Okay, good. I appreciate that. And we thank you so much for being a good patient for us and trusting us and entrusting us with your hearing aids and your treatment.
All right, thanks, Matt.
Yes, sir.